This is the second in a 5-part mini-webinar series entitled Achieving Psychotropic Medication Reduction in Long-Term Care. Lake Superior Quality Innovation Network serves to improve healthcare for Medicare beneficiaries across the healthcare continuum through a collaboration between the following quality improvement organizations: Stratus Health of Minnesota, Medistar of Wisconsin, and MPRO of Michigan. After this webinar, learners will be able to distinguish the difference between antipsychotic and psychotropic medications. A psychotropic medication is defined in Regulation 48345C3 of the State Operations Manual as any drug that affects brain activities associated with mental processes and behavior. Psychotropics are also called psychoactives, and these medications impose their primary or significant effects on the central nervous system, thus affecting the mind or mental processes. Psychotropic medications include the following classes: antidepressants, antiepileptics, also called anticonvulsants, anxiolytics, hypnotics and sedatives, antipsychotics, and mood stabilizers. The 2011 Office of Inspector General report introduced in Webinar 1 focuses on the class of psychotropic medications called antipsychotics. Antipsychotics are a class of psychotropics further categorized as typical, or first generation, and atypical, second generation. Concerns regarding adverse events associated with use in elderly residents involve both first and second generation antipsychotics. However, black box warnings were issued in response to the increased use of atypical antipsychotic medications. In current drug nomenclature, medications are divided into two classes: the pharmacologic drug class and the therapeutic. Pharmacologic drugs have an approved indication for a diagnosis, and the Food and Drug Administration, or FDA, has deemed them scientifically valid and clinically meaningful to treat the indications for which they are prescribed. According to this definition, psychotropic drugs fall under the pharmacologic drug class. Medications in the therapeutic drug class are considered to have a therapeutic equivalence. This means that drugs elicit a therapeutic effect and may be substituted for one another with full expectation that the substitution will have the same clinical effect on the resident. For the diagnosis of dementia in the elderly nursing home population, antipsychotics fall under the therapeutic drug class without meeting the pharmacologic criteria of having an approved indication for that diagnosis. Yet antipsychotics are often prescribed for off-label use to treat behavioral and psychological symptoms of dementia. Off-label use refers to the use of a medication that does not have an approved pharmacologic indication for a diagnosis. For example, antipsychotic medications are not approved for indications related to dementia, excluding dementia with a diagnosis of Tourette's syndrome, Huntington's chorea, and schizophrenia. However, early use of antipsychotic medications to treat behavioral and psychological symptoms of dementia were regarded as successful, and off-label prescribing was considered acceptable treatment based on a clinician's professional discretion. After 5 years of consumer use, the FDA announced a formal alert known as a black box warning to the public and the medical community regarding potentially life-threatening consequences associated with the use of atypical antipsychotics in the elderly population with dementia. Pharmacy personnel may be employed to educate the interdisciplinary team and frontline staff regarding psychotropic medications, their classes, and common usage. The pharmacy team keeps record of residents currently receiving psychotropic medications in a facility and can assist to educate the IDT on pharmacy recommendations recorded on the monthly medication regimen review, as well as information related to drug doses, duration, and continued need. The core IDT can then review the most recent MDS assessment for mood, function, and behavior. They can then review medical records, taking note of psychiatric diagnoses, psychiatric hospitalizations, abnormal clinical and lab findings, and related physician, pharmacy, and psychology notes. The interdisciplinary team may then review any gradual dose reduction that occurred within the past 6 to 12 months and the outcome of that attempted gradual dose reduction. In webinar 3 of the 5-part series, learners will be able to understand the impact of psychotropic medications on resident quality of life and quality of care as we work toward achieving psychotropic medication reduction in long-term care.